October was Breast Cancer Awareness Month, and the theme of this year's commemoration was every story is unique, every journey matters, every breast cancer diagnosis is personal. Behind every diagnosis is a story of courage, resilience, and hope. This theme is designed to be a reminder that breast cancer touches the lives of women and their families around the world differently, and that every journey deserves compassion, dignity, and support. This year's theme also recognizes the diversity of experiences and reinforces the need for compassionate, timely, and quality care for all, regardless of geography, income, or background. Joining us now to have a conversation about all of this is public health physician, Dr. Blossom Maduafokwa, with a view to further understanding the message behind this year's theme, aspirations and targets of various interventions galvanizing the fight against breast cancer, institutional support, and tips to stay safe from the malaise. Good morning. Welcome to the morning show. Thank you very much for joining us.
Good morning.
And you know, it's good that you're joining us now. We're in pink.
Yes, absolutely.
October just wrapped, and now we're in November.
Correct.
You heard my introduction.
Yes.
I think the biggest question is tips to avoid the malaise. Please share with us.
Thank you so much for having me. So when we talk about breast cancer, people always ask me, but what causes breast cancer? To understand how to prevent breast cancer, you need to understand the causes. So first of all, there is no known cause. However, we have what we call risk factors. We do have risk factors that you can't do anything about, like your age, being female, for example, having a family history of breast cancer. However, there are risk factors that you can do something about, and that's how to prevent breast cancer. Example, being overweight or obese is a risk for breast cancer. So maintaining a healthy weight is a way to prevent breast cancer. Abuse of alcohol increases your risk for breast cancer. So limiting your alcohol intake is a way to reduce the risk. Increasing physical activity and exercise, and also proper nutrition that helps you manage your weight. So these are ways that you can actually take control and prevent breast cancer. People don't realize that 30% of the risk for having breast cancer can actually be controlled by making these lifestyle changes. Yes.
All right. I mean, that's quite interesting, and it's always good to have you on the show, you know,
Yes.
to enlighten people. But then a lot of people will ask, beyond the pink ribbons and hashtags,
Yes.
what did we record in terms of the cancer awareness month last October, last month, which was October?
Yes.
Were there any good news? Was there any hope beyond the fact that every year we're trying to raise awareness? Did anything new crop up in terms of innovation, in terms of something that can give hope to people, particularly those who are suffering from cancer-related issues?
So that's a great question, because what we're realizing is that breast cancer survival, the 5-year survival rate for breast cancer is about 90% in developed countries. But in a country like Nigeria, it's about 40%. So we're realizing that there are more systemic factors that contribute to individuals not surviving breast cancer. So one of the things that we're trying to do differently include focusing on the health system, ensuring that people have broader access to healthcare so that we're able to detect breast cancer at the early stages to improve survival. So, I mean, there are other things like the social determinants of health, poverty, etc., lack of education. These are things that we're now realizing we need to focus on these things to increase the survival rates of individuals that live in these parts of the world.
Yeah.
You know, these are very, very important issues, I would start by saying, because first of all, in as much as I would say there's been some progress in terms of early detection as well. There's been some progress in how women can also detect these things for themselves, these issues for themselves. But I also want to talk about the way and manner in which it is handled, especially for those in its early stages. Why is it that we often find cases where, for most women, it's usually at the almost detrimental stage?
Yeah.
And where is the place of alternative medicine in this situation? Because I find that the first and the go-to solution is usually chemo. Let's do that. But what a lot of people don't realize that you need to actually boost your immune system to handle the effects of chemotherapy. So where is the place of understanding alternative medicine and its synergy with traditional, that is, I think they call it conservative or something medicine. I don't know. Traditional medicine, what we know as, your regular doctors in hospital. Where's the place for that? And why do we usually detect so late?
So I'll take your last question first. The reason that we detect so late is because individuals lack access to the health system. So there are parts of the world where every year you go to the hospital for what we call a well woman exam. So a doctor examines your breast. If you're up to the age of 50, you have your annual mammogram. Those things are tools that aid early detection. And those tools are not readily available to individuals in these parts of the world. So that's why detection tends to end up being quite late. So because individuals, like, you don't have money to go to the hospital, they send you for a mammogram, you can't even afford it because you have to pay out of pocket. Yeah. So that's why it's usually detected late. In speaking about the synergy between modern medicine and alternative medicine, I will say this: we try to rely on evidence-based management of breast cancer. Because I have personally seen, particularly in this part of the world, where we believe, it's my enemies that are causing it, or I'm going to go and pray in a religious facility. Cast it out, exactly. I've seen people actually die. I've seen people die, even though it was detected late, but they relied on those alternatives and basically said, we're not going to go the route of modern medicine. Maybe they said, you have to actually do a mastectomy or whatever. They rejected that and went for the alternative option and ended up losing their lives. So we actually try to raise awareness, because you can't substitute that for evidence-based medicine. Of course, proper nutrition, that's a no-brainer. You have to have your immune system at a level where you can handle chemotherapy, but you also have to understand that evidence-based medicine that has been proven to work for many, many decades should be your first option.
So are you against alternative medicine at this point?
No. So
sorry, the reason I ask is because you have actually identified preventive measures, like, the lifestyle and all of that. Would you suggest that alternative medicine should be in place before detection, or is alternative medicine an option at all?
So alternative medicine is sort of a broad umbrella that encompasses so many practices. So first thing is, what exactly is that alternative medicine? So some might be beneficial to you, some might be actually harmful to you. Because I've seen people go the route of some of the supplements that have not been tested.
I'm speaking like nutrition, like what you have highlighted.
Correct.
Nutrition.
So that's why I said it's broad. So you have to be specific as to what the alternative is. So, for example, proper nutrition, it's a no-brainer. It's also one of the ways to prevent, to reduce the risk for having breast cancer. Proper nutrition, which will actually help you to maintain your weight, which we know being overweight and obese is a risk factor for having breast cancer. So that is actually very important.
All right, doctor, I'd like you to speak about an aspect of breast cancer that is least spoken about in Nigeria, and that has to do with breast cancer in men.
Correct.
I read about the fact that in America, as of today, out of every 100 diagnoses for breast cancer, one is in a man. Where are we in Nigeria, and how does it work? What is breast cancer in men? What causes it? Who are more disposed to it, and do we have it in Nigeria?
So I love this question because people really assume all the time that breast cancer happens only in women. I remember being a fourth-year medical student, the first time I saw breast cancer in a man. I could not move for like 2 minutes.
Where was that?
In the hospital, in a teaching hospital, my medical school. And I remember my teacher saying to us at that time that breast cancer tends to be more lethal in men because they seek help very late. Why? Because one, they're not even expecting it. And two, there's sort of that shame of what is going on. And then three, the health-seeking behavior in men and women are completely different. So to answer your question, even in Nigeria, out of 100 people with breast cancer, 1 is a man as well.
Even in Nigeria?
Even in Nigeria, yes.
There's some data to that?
Yes, there is. So when we spread this message, like I did a public service production a few weeks ago, and I did keep stressing that men also have breast cancer because people don't understand that everybody has breast tissue. It's just that women's breast tissue, of course, is more developed. So men also have breast cancer, so they also have to be on the lookout. If there's even something as tiny as a pimple or like a grain of rice, something tiny, change in the color of the skin, you should seek help from your healthcare provider.
Invasive ductal, what does it mean?
Yes. So the breast tissue has different parts.
Okay.
So the duct is it's like a tube where the breast milk comes if the woman is breastfeeding.
Yeah.
So the cells surrounding that tube can become cancerous, and that's where you have your invasive ductal.
Even in men too?
Yes.
All right.
Now, just one minute. I was going to just say that you talked about if you notice anything, reach out to your doctor, see a healthcare provider. Now, obviously, we know the state of our primary healthcare facilities in Nigeria. Correct. So reaching your healthcare provider basically means going to a hospital, and not just going to any hospital, going to a hospital that understands how to cater to that issue so you don't end up with a wrong diagnosis. Correct. Or a biopsy that expands the problem for you. These things are very expensive. And looking at the standard of living in Nigeria today, a vast majority of Nigerians cannot even afford the healthcare that is required to treat this disease.
Correct.
Where is a place of government support in all of this? Because there must be some kind of healthy balance here.
Yeah, I completely agree with you. Which is one of the reasons why I said people present late, because they feel like I can't afford it. But people actually don't know that primary health centers provide free healthcare. So you can actually walk into a primary health center and get free health. All you need to do is pay for your card. So there's something we call a well woman exam. It's something that is done annually. So you walk into the hospital, a woman walks into the hospital, and you have your breast examined by a trained professional. You can actually get that done for free. So people are not aware that there are services that you can access without actually spending money.
Oh, what are these services? And that's where my question was, because you have identified that about 40% of Nigerians, die through this breast cancer issue, which is quite alarming. And so that's what I want to understand. Where are these locations that these people that cannot afford the care that they need, where can they go? Can you identify those areas for our viewers?
So every ward, let me use Lagos State as an example. Every ward in Lagos State has a primary health center. Some of them have even 24-hour primary health centers where you can walk in at any time and access services. So you can get those services for free. So where we are having a challenge is, for example, if a person gets, say, diagnosed with breast cancer and the person needs to get treatment, that is where the problem will start, because most people may not be able to afford the surgery or the chemotherapy. That's where you start seeing in WhatsApp messages, people are trying to raise money, etc. So that's where limited access to healthcare is a big issue in this part of the world. It's a very big issue. Only 10% of individuals in this country have access to health insurance. So every other person basically pays out of pocket. So it's a systemic issue that needs to be fixed.
If you were to speak to the government about this health insurance, what would you say?
So we do.
And how do you think that they can go about
So we do currently have a National Health Insurance Authority that has sort of rolled out services. One thing is that individuals are not actually aware that they can access these insurance services, except for, say, people in the organized sector. Like individuals, for example, the woman selling tomatoes on the streets or selling groundnuts may not even understand how they can access these services. So health insurance is available. However, it needs to be rolled out in a more organized fashion to as many people in the informal sector as possible.
All right. And if you were, we're now beyond the Cancer Awareness Month. We're now in the month of November. If you were to advise a woman today, what would that advice be for our Nigerians that are watching now?
So my advice to women and men.
Yes, of course.
So there's something we call a self-breast exam, right? And it's a woman actually examining your own breast yourself to detect any changes that can raise an alarm for you to now seek help at a healthcare facility. So that's one. Learn how, so my message to Nigerians is learn how to do a self-breast exam. Number two, do an annual checkup. So during your annual checkup, what we call a well woman exam, you're going to have your breast examined by a healthcare professional. So that if there's anything that is out of the ordinary, you can get the help that you need as soon as possible.
Well, thank you very much.
And also, last but not least, every woman up to the age of 50 should get an annual mammogram.
Absolutely.
Yes.
All right. Thank you very much, Ms. Maduafokwa, for joining us on the morning show, and thank you for enlightening our viewers.
Thank you so much for having me.